Welcome to Senior Issues, Etc. My name's Jamie Portner, your host, filling in for Vita Verdon. Vita is still in rehab, and I am honored to be filling in for her today. Like I said, my name is Jamie. Just to give you a little bit of background on me, I was one of her many mentors. Her and Gloria, they took me under their wing and helped me to develop my own TV show, which is Dietitian's Dialogue. They helped me to create this fabulous TV show, as they are wonderful, wonderful, wonderful mentors. So I cannot thank them enough for all of their knowledge they have provided me. So as I am her host and cannot thank her enough for giving me this wonderful opportunity, I have a wonderful guest on here today, and her name is Alison Smetana. She is an occupational therapist, and she is here to provide us with a wonderful knowledge of information. So hi, Alison.
Hello.
Thank you so much for coming on the show today. Before we get to the meat and potatoes of your job, let's tell us a little bit of something about you today.
Me, okay. I have been an occupational therapist for about 30 years. Took a little time off to start and raise my family. I have a 20-year-old son.
A 20-year-old son,
yes.
Very good. And anyone else in the family?
My daughter, Molly, is 16 and a half. She's driving.
Oh.
And my son, Taylor, is at Indiana University, his sophomore year.
Very good. So as Vita would say, because I know this is her show and I know she would love for you to do it, I want you to give them a big kiss.
All right. Where do I go? That's to Taylor. That's to Molly.
And then how about, is there any special someone in your life?
My husband, Michael.
Oh,
and my
good.
dog, Peyton.
They need kisses
yes,
too then.
They do. He gets lots.
All right, good. So let's then step forward, and then let's talk about how you became an occupational therapist.
Okay. So many moons ago, when I started college, I knew that I wanted to go into the healthcare industry. And I just wasn't sure exactly what I wanted to do, but as I explored the curriculums and saw the balance of science with also something that was a little bit more whole than physical therapy for me, and I can go into the difference between those two because that's a big question that people have. But occupational therapy combined a little more psychology and even some crafts, because it's all about how you use your function to get through life, basically. So that really appealed to me, and I went down that road. I have my bachelor's of science in occupational therapy. Now you have to have your master's to practice OT, and for physical therapy you have to have your doctorate. So I've been doing it so long that I got away with a little less schooling, a lot more experience.
Okay.
Though. And then the last year of school, you do rotations, internships, and so I was able to try out some different areas of occupational therapy to kind of find my niche.
And so what is a typical day then like for you?
Well, a typical day for an occupational therapist really depends on what area of occupational therapy you're specializing in. So there's pediatrics, they can work in the school system, at the hospital where you're dealing with people who have dealt with more medical issues, a very high geriatric, the senior population.
And that's something I definitely want to touch on in a couple of minutes.
Yes. I spend a lot of time actually working with orthopedic injuries, which also can incorporate seniors, but also work-related injuries. Prevention is really, really, really important in all areas, but I focus a lot in industry. So ergonomics, setting up work so that to minimize injuries, teaching people the right exercises to do to keep their bodies healthy and to rehab back from, an injury or health issue. And so a typical day would really start with your schedule and what kind of patients you have. That's varied. For each individual, we do an evaluation, a very extensive evaluation, to look at the components of function. So how do you move? What's your strength? What's your balance? vision, perception, all cognitive functioning, how you're able to reason and process, and identify, and again, that will connect with a diagnosis, but we'll identify where the limitations are and then make a very specific treatment plan for each individual. And then we just use each session to start working our way through that.
And with a treatment plan, how long does it depend on each individual person?
It really depends on each individual person. In terms of the senior population, we are dealing also with the Medicare cap, so we really consciously try to work on those visits, and I always believe in pulling in the patient as much as possible to their own rehab. They need to carry over what we do with them for the best outcomes and results, but even more so now. It's really important to do that because there's only a certain amount
that Medicare will pick up?
Is allowed, yeah.
And then ergonomics, that seems like a big word, and I'm sure our viewers want to know exactly what that means as well.
Right.
So can you kind of break that down for us? Tell us a little bit what it means?
Absolutely. It's actually very simple. It is, how do you make your job easier, or how do you set up any work or home situation? Ergo is the study of movement, and it's really, when I look at it in industry, it's fitting the job to the worker. So I explain to the people I'm working with, it really is, how do we make your job easier? How are you positioned so there's less stress on your body, there's less fatigue, you don't feel the aches and pains that you normally might if your workstation isn't set up that way. So in a computer workstation, when we're looking at the right head and neck posture so you don't end up with an achy neck, we want to make sure the monitor's at the right height. If it's lower, you're looking down, your center of gravity has changed, these muscles are working all day long, and of course you'll feel aches and pains later. So we look at very specific design of how much you're reaching and how your arms are positioned so that we take the stress off the body. And really, that applies, again, kind of bring it back to seniors who are either working, even looking at print, how things are designed so that we minimize any issues with balance, which as time goes on, our bodies, we experience a little bit more challenges in balance. Even at home, to look at and kind of I encourage people to do their own safety check at home, the same way I would do at a company. Just look at, at the floors. Are there any rugs that could provide, for some throw rugs or anything on the floor that might be a little bit more of a challenge? The height of getting up and out of chairs or bed or even in the bathroom. So, taking a look at all those things and just taking a step back and reevaluating, okay, this is my level of function now. Might not be the way it's always been, but things change, and so readjusting to that, which is a really important part of really just making that transition.
Absolutely. And so another big thing I know goes hand in hand with an occupational therapist, and I know is very important for our senior population as well, is ADLs. So, why don't you, the expert, tell us a little bit about those?
Okay, so ADLs is activities of daily living, and it's everything you need to do in the course of a day to take care of yourself and maybe take care of others if that's part of your role. Either as a parent or a caregiver or anything else that might extend to. So we will look at, again, those activities. I just kind of go through a day with my patients. So, all right, you're up in the morning. Are you able to get your socks and shoes on yourself? Get yourself dressed, get to your hygiene. And where those limitations come up, we look at the rehabilitation process. So you want to strengthen so that your body can do as much as possible, you can move as much as possible, and where there are areas that there's that gap there, we look at adaptive techniques or adaptive equipment even. So there's something called the sock aid, and it actually, you can slip a sock on it and kind of toss it down to your foot and pull the apparatus up, which will pull the sock on. So if you don't have that reach, or if your balance is challenged when you're doing that, or you don't have the motion, it's an adaptive device that will allow you to still get dressed on your own.
Can you expand then a little bit more on some of these adaptive devices?
Sure. So if we look at the different senses that we have, that over time, people experience a lessened degree of function. Like I said, balance. So just how you're moving around. Really, a cane or a walker is actually an assistive device. That's a hard thing for sometimes people to transition to more mentally and emotionally. But I always like to go back to the fact that that's allowing you to continue living your life and going and doing things. And so try to help people see the positive aspect of it. Dexterity, so your fine motor skills, buttoning shirts or putting on earrings. There are some adaptive techniques for that. Adaptive equipment. There's something called a button hook, and it just is a big, like a big cylinder, and it has a little wire attachment that you can actually put through the buttonhole, grab the button, slide it through, and it will button your shirt, and if you don't have the dexterity for that.
And the button hook, would that be something that is going to be more for someone with arthritis, or is that going to be someone that is just recovering from maybe like an accident per se?
Probably more arthritis. I just worked with a patient with multiple sclerosis who's lost that capacity, and encouraged him to go ahead and use that. The other, someone who's coming back from an injury, maybe a more orthopedic, we really focus on if they're living alone and that's something they need to be able to do. It's definitely there as a temporary. But we really work on maximizing their function and getting that range of motion so that they can, do the most on their own without any assistive devices.
And how about, can anyone come to see an occupational therapist, or do they have to have a prescription from a physician?
They do have to have a prescription. We can do an evaluation without one, but quite honestly, our policy is to have the script because treatment will follow that. So we work very closely with the physician to get the order, but and communicate back the results of our evaluation and our plan of care.
And one other thing is that when, as an occupational therapist, you mentioned at the very beginning that there are several different routes that one can be. Can you explain a little bit more in detail where these different routes can take one?
Yeah, they're in some ways they do fall under the umbrella of function, but in some ways they look very different. So a pediatric therapist could be working with any age from a newborn that might be born with some developmental delays. We'll work with them on promoting the development through positioning and actually even little baby exercises. They might work in the school system, so working with kids that might have some attention disorders, or children that have low tone, working on their posture and some adaptive techniques there. Even writing. That's a big one, writing and fine motor, using scissors and all that. Another area is vestibular, so balance, and actually working with people that might have something going on a little bit more internally in terms of balance. Orthopedic is a very, very popular area. Back problems, shoulder injuries, neck, knees. Yeah.
Well, it seems like there are a lot of different things, and it seems like you are very passionate for what you do. So we appreciate all of this wonderful information, and thank you so much for coming on the show.
Oh, no, we got 15 minutes.
Oh, I thought you were... So what other opportunities are there then to come on to, can you expand a little bit more on vestibular and more on pediatrics?
Yeah. Well, so pediatrics takes, like I said, there's just a range also of, you know, of a population, whether it's developmental or maybe just injury related. But the whole concept of occupational therapy is really on function. So the exercise that you're doing might just be really through a functional activity. For instance, instead of just raising your arm 10 times, we might have you placing, you know, something that, placing some clothespins up on a line or something. That it incorporates different mindset, I guess I want to say. You're doing the exercise, but you're also incorporating a lot of functional activity. Like, how would that carry over to home? That you have to put away dishes or groceries that might be, you know, in different positions. With kids, you know, the therapists are awesome. They want to make it as fun as possible. It's about incorporating it in play. So at Condell, we have the Wii. They have all kinds of, there's a climbing wall there. There's big balls and mats and bolsters that the kids will get their therapy, but it's incorporated into play.
So you talked a little bit about the Wii. So is that kind of something that would be like more of, would you consider that as an adaptive device? Or that's just kind of something that you can use to kind of help to, you know, help them with their motion and everything, like their ADLs?
It's more with, you know, just getting the movements and getting the components of functions that you want just while they're having some fun doing that. They might not even know that they're doing, you know, what it is that, because, you know, you tell a kid to lift their arm up 10 times, that's not so much fun, or to hold their core tight. But if you have it, the Wii, you know, controls positions in a certain way, that the only way they're going to do that is by doing those things. They're incorporating that without really, you know, having to follow that instruction that can be kind of boring to a kid.
Absolutely.
Yeah.
Now, another thing, though, that I definitely want to touch on that we did not touch on at all, I think, is going to be the difference between, and I'm sure you get this all the time, an occupational therapist and a physical therapist.
Yes.
So explain to our viewers what the difference is and how someone would need to see both.
Okay. You know, I have said many times, an excellent occupational therapist will kind of overlap a physical therapist, and a physical therapist will do the same with an OT. But generally speaking, physical therapy looks at the physical aspects of function. So movement, reflexes, strength, balance, the, you know, really very physical aspect of it. Occupational therapy looks a little bit more whole. So in terms of function, everything from cognitive, like I said earlier, the, you know, can you, after a stroke, can you figure out how much money you have to give to pay something and how much money you're supposed to get back? Can you follow that logic? We look at fine motor coordination, dexterity. We'll look at, again, those components of function, like what limits you from just doing your everyday activities, your ADLs. So we incorporate, like I said, a little bit more activity-oriented therapy so that we're addressing all of those areas. So it is a very fine line. Occupational therapists, when you go for hand therapy, if you've, over the winter coming up, we see a lot of what's called Colles fracture. It's the common injury when you fall and catch yourself, you know, on slippery ground. So the doctor will actually refer for occupational therapy. The hand region, the hand, elbow, sometimes higher than that, is considered really a specialty of occupational therapy. And you can be a certified hand therapist with that specialty under occupational therapy.
Oh, wow.
Yeah.
And then also, how about, and I think you mentioned a little bit of this, but we want to know a little bit more. How about warm water therapy? Is that something more per se an occupational therapist does or a physical therapist does? And if so, an occupational therapist does, can you go a little bit more into it?
Sure. And I can touch on physical therapy as well.
Okay.
So physical therapy, we have Condell has 2 aquatherapy pools. There's one at the Center Club in Libertyville, and the other is in Gurnee at the Center Club. It's wonderful for arthritis. It's wonderful for people that just have a lot of trouble or pain with gravity. So we'll see people with back injuries or knee issues that are just not able to do as much on land because of that whole weight bearing and gravity. So physical therapy will take them into the pool and work on those things with them. As an occupational therapist, I take people that I'm trying to get back to their jobs. If they're having a lot of pain issues and they can stretch better in that warm water, I'll incorporate it that way. But that is primarily physical therapy. When it comes to the pool for kids, it's both OT and PT because again, they're focusing on different aspects of function and they're pulling in that play. So a child who might not be using their right arm a lot, they might, throw a toy over in the water and then they'll just have to scoop through. So they're getting a lot of resistance and strength and feedback sensory-wise to get that, toy that's out there. So OT and PT both utilize the pool. It's really a great way to incorporate therapy.
And with that, again, do you need a prescription or?
Yeah, we do. We need a prescription. Each pool therapy client will start off with a land evaluation, so we make sure that they are solid and going to be safe to go into the pool and that we can address exactly what they need, in the pool. So the first one will be an evaluation on land, and then again the treatment plan is formed and they'll go into the pool after that.
Very good. And so what else would you say that is a big token for if someone is in, let's say, college, and they're maybe, let's say freshman, sophomore year, what would the big thing be to take away from becoming an occupational therapist? What do you think if you were to go back to school, you would need to know about becoming an occupational therapist?
Mm-hmm. That's a great question. It sounds obvious, but you really have to love working with people. You deal with all kinds of people, and everybody comes with their own story and their own history. And I think to be able to handle that is really important. The interest in the physical, the actual physics of motion and really grasp the science and the anatomy, physiology. I remember in school studying that so hard, but it's funny now you look at it and that's just part of function. Mm-hmm. You learn where to line up the measurement tool to measure joint is called a goniometer, and we had to know exactly what bony landmarks to line it up with, but now you look and you say, okay, I want to measure the elbow. I'm going to put it here and here. It's just funny how things evolve, And then what's different now than when I was in school is you really have to have a little business, perspective. Just because healthcare we deal with different insurances and different, Medicare. We've gone through a lot of transitions with that, and we have wonderful support office staff, but the therapist, it's in our hands as well to really be aware of that and incorporate the limitations into our care. So,
well, that's some great advice. And then also one advice that I would like you to give to our viewers, what one thing or maybe even 2 things you can give to our seniors? One thing that they can take away from this.
Mm-hmm. Well, one thing I want to mention is at Advocate Condell at the medical center, but we also have many offsites. We have Condell in Libertyville. Mm-hmm. We have a Gurnee clinic that has occupational and physical therapy. We have Vernon Hills that has occupational and physical therapy. We have a Grays Lake that has physical therapy. And we have Lincolnshire that has OT and PT. So there's a lot of different options for for getting the care that you need. But we also do balance screens, and several times a year there's a class called Matter of Balance. And I would encourage people to attend that. You can get more information by calling the number at Condell directly to the Orthopedic and Spine Institute is 847-990-5555.
And what is that number again?
847-990-5555. And they can help direct in that in terms of balance screens. I would really encourage a couple things. One, the takeaways, stay active. Try and not just do your normal movements, but reaching your arms really up. If you don't use it, you lose it. We get stiff when we do less, and so when we go to move our bodies, then it's a little bit harder to do. And the other thing is really take advantage of the programs that are out there, like the balance screens, and there's a lot of informational to embrace that the changes of aging, and keep yourself safe. Probably the biggest thing that we see are the falls, the injuries that sometimes are just really a result of not adapting to a lifestyle. So a fall or being hasty about something.
Sure.
When
Sure.
your body isn't, your head's wanting to do it, but your body isn't quite yet. So just education.
Thank you for that information. And one last thing before I let you go. What is your passion and where do you see yourself?
My passion really, I've been very fortunate. This career, occupational therapy, I've been able to adapt it to my lifestyle. I love natural healthcare and approaching that from the very mind-body. I love yoga. I think yoga for seniors is wonderful. Chair yoga, the breathing aspect of it is super important. Just pulling oxygen into our bodies. I teach yoga to children. I think it should go all the way up to seniors. So really just my passion is in bringing that awareness to people. And I think that most people, if they can be proactive, we have the tools to use.
Great.
It's just a matter of knowing how to. So.
Absolutely. Well, Alison, thank you so much for coming on. Thank you for sharing all of your wonderful, wonderful knowledge. It was a pleasure to have you on. And again, thanks so much.
You're welcome.
So for all of you out there, we just want to say thank you so much for coming on. For Vita, I want to say thank you so much for having me on the show. It was a pleasure to be the host on this show, and it was a pleasure being mentored by you. Again, Alison, I can't thank you enough for having you on the show and sharing all of this wonderful information. As Vita says, or if I get this somewhat right, at the end of the rope, tie a knot and keep on going, 'cause the best is yet to come. Catch the spirit. And let's just catch that spirit a little bit longer and let's keep on going.